The future of innovation within PHRs and EHRs is exceptionally exciting. We are envisioning a thing much like the Intel speaker before us, where the PHR is personalized and targeted data. So as you log into your PHR, if you have a health-related condition, you're going to be seeing health-related news updates that maybe pertain to you. Billing management is another service that's going to start being rolled out with PHRs, meaning you're going to get your EOBs and your billing statements. You're going to go into your EHR and your PHR, and part of the job of the PHR is to analyze that statement automatically. Provider and payer reviews. This is also going to be something that's coming along down the pike as more and more of us start using PHRs. We're going to start reviewing the places that we go to, because again, we're getting more concerned with this since we're paying more of the bill. And finally, true synthesis of data, and this is true interop, where EHR, billing, prescriptions, EOB, coverage, journals, everything is in one location for patients to access. That's really all I have for you. Thank you again for attending this conference, and thank you all for setting it up.
Thank you. We can't take one, if you could stay here for a moment, Nathan. We can't take at least one question while we're being set up for the next panelist. That's a cue for Nathan, you know. So, or God, I guess, as he's going by now. And we'll take our first electronic question, and it was posed by Deborah, and so she's in the room. Why don't you just ask her? Okay.
Hi.
At the beginning of your talk, you mentioned patient ownership of healthcare data. And one of the issues that is a barrier in that area is the question of the legal ownership of patient data. Can you talk a little bit about how you dealt with that?
Well, I mean, I'm not a lawyer. Let's just start that off right now. This is not legal advice. One thing that we really try and make clear with our members is that they own their data. This becomes much more of a question when you talk about employers and insurers coming out with their own PHRs. You know, patients really can't be assured that they own that data necessarily. And we really do this through a series of contracts when they sign up with us. And part of this, and part of the functionality we're sort of envisioning for the future is an opt-in kind of a functionality where if we are going to use even any of their data for any purposes, including research, even if it's de-identified, we want them to opt into that. We want them to decide, yes, I want to be included in these, or no, I don't. And if they don't tell us, then they're not included. This is in stark contrast to how things are typically done in IT right now, where it's mostly opt-out. Again, but to answer your question more specifically, it's mostly through contracts, and it's mostly an agreement between, you know, the provider of this technology and the patient.
Great. Thank you again, Nathan.
Thanks.